what are the biggest challenges that you're seeing? Kasi right now, the LGUs are pitching in, the private sector, the businessmen, the hospital association, they're providing the cold chain. What are the major challenges you're seeing once the vaccine is finally rolled out?
I think it's very critical to get the public to start to understand what we should be expecting from these vaccines, what's reasonable to expect, no? And also to build trust and confidence in the vaccines and in the process also. So those are really going to be very significant communications challenges that we're already working on now, sector by sector. We're targeting first the health workers because we understand that they're going to be the first set of people to receive these vaccines. And you can imagine if the uptake among healthcare workers is low, what kind of confidence will the public have? No? So we really need to communicate and reach out to the health workers and address their issues so this can be settled before the vaccination program rolls out. Maybe if you'll allow me, I'll share what I share to people who ask me personally what my choices are. Because it's a typical question, no, that anybody would ask a doctor.
Yes, ma'am.
So first, what I tell my friends is, when you choose a vaccine, paramount yung considerations of safety muna. Minsan over efficacy, actually always over efficacy. You have to be able to prove that that vaccine is safe, then you look at efficacy. Now, in this current scenario and in every other scenario where vaccines are made available to the public, there are evaluations that are made by different groups to ensure that these vaccines achieve quality standards of safety and efficacy. Now, because COVID is such a new disease, we're actually more than careful when we look at the properties of these vaccines. Normally kasi, ang tumitingin niyan is FDA. Then if this becomes available or should be available in the public program, then that's HTAC. And then it's commercially released. But now, not only do you have FDA, you also have HTAC, you also have the vaccine experts panel. FDA also has its own vaccines panel or scientific advisory group. Then you also have the NITAG. So that's like 4 or 5 different technical expert groups that are looking at this before it even comes out to the public. So with that in mind, no, and for as long as we're assured that that process is followed, then for me personally, I say whatever becomes available first to my hospital is what I'm gonna get, because my mindset now is if I'm not vaccinated, I'm zero protected because there's nothing. But if you can give me something by next week or by next month, that's sana 90, no? Pero kung 50 yung available, that's still better than not getting anything at all.
Okay. I guess, ma'am, I think everybody's in agreement, man. They have a lot of faith in the experts, in people like you, the people in FDA. People and I think this is not going to be controversial to say the problem of the people is with the politicians. And there seems to be a dissonance. I mean, what are we missing here? Because there seems to be a dissonance between what the experts keep saying and keep reassuring us, huwag kayong mag-alala, may proseso, basta magdaan sa proseso. But what we're hearing from Malacanang is, don't be choosy. Wag na kayo maraming tanong. Wag niyo, magtiwala na lang kayo sa amin. And then at the end of the day, ang nakabalandra dyan are the Chinese-made vaccines that do not have EUA yet and that have not gotten the results yet on the third phase of the clinical trials and so on. So there is clearly a dissonance there. So not to put you on the spot, but my question to you as an expert is, we trust the process, but do you trust that the process will ultimately win out over politics and will ultimately have the final word here?
So speaking now as somebody from HPAC, we've made that our objective, no? That we will safeguard the process. That will be our commitment to our colleagues whom we represent, so that we can ensure that when we talk to our patients and say this is a good choice, we know where that particular recommendation is coming from.
So we can be, I'll follow that up now, we can be reassured na hindi ma-overturn yung process or someone will jump the gun on you. Kasi yun ang nakikita namin ngayon. Starting with the vaccination of the PSG way back in September. And then, yung sinabi nga, one cabinet member daw got vaccinated. Hanggang ngayon, we don't even know who this person is. So, merong perception yung public na wala namang masusunod dyan. It's every man for himself. Yun ang perception ngayon. How do you overturn this perception? And it's not entirely a baseless perception, considering what happened. So we're trying to get some reassurance from you guys dahil kayo yun directly, you are supposed to administer. Sinabi ng PSG, kami lang nag-administer sa sarili namin. Yun nga, na-bypass na kayo doon eh. So, how can we be reassured na kayo nga mismo, baka mamaya may pupunta dun sa probinsya, sila din, kanya-kanya din sila mag-vaccinate.
And let me get straight to the point. When the president himself says na, huwag kayong mag-alala kasi yung efficacy ng Chinese made, kasing galing naman ang efficacy ng galing sa US at sa UK. There's no basis for that, and yet that is the president telling the whole country. So, and again, that's not just dissonance, that's totally counter to what we know so far.
I guess we're saying we trust your process, but there are so many people jumping the process.
Yeah. So, you're really raising very difficult questions that we ourselves are grappling with.
Okay.
And of course, I have to agree that there's dissonance. Parang bulag ka naman kung hindi mo i-acknowledge yan di ba? Kaya nga kami, our commitment nga is to ensure that we guard the process because we already know that that's happening, that there is a lot of discussion going on in public about why this is happening and why that is happening. And, we can only control what we can do. And for as long as we're able to do what we're supposed to be doing and not compromising those principles, then we hope that the public will also come on board with us and support us when we ensure that the processes are being followed.